Hey YouTube fam, welcome to my YouTube channel and thanks for clicking on this video. But before starting today's video lecture, I would like to thank each and every one of you for your love and support. It is because of your love and support our YouTube channel has crossed 100 organic subscribers, hoping for the same positive response in the near future as well. In the previous video lecture, we discussed a very important phenomenon of adrenaline, and that was Dale's vasomotor reversal. We also talked about Dale's vasomotor re-reversal. Then हमने कुछ ऐसे ड्रग्स देखे थे. For example, we saw adrenaline, noradrenaline, isoprenaline, and ये जो सारे के सारे ड्रग्स है वो कौन से रिसेप्टर पे बाइंड करते हैं, and after binding to that specific receptor, what will be its response, and ये response हम अपने फायदे के लिए कैसे यूज कर सकते हैं. अपने फायदे के लिए मतलब therapeutic use. We also saw the therapeutic usage of these drugs. Then we talked about beta-2 adrenergic receptor agonist. वहाँ पे हमने देखा था that what drugs can be used in case of bronchial asthma. Now can you recollect कि ये जो beta-2 adrenergic receptor होते हैं वो और एक जगह पे प्रेजेंट होते हैं. You are right, that is pregnant women uterus. वहाँ पे when we stimulate our beta-2 adrenergic receptor, there will be relaxation of uterus. And in which condition we need to relax our uterus? The answer is preterm labor. So in preterm labor, we will relax our uterus. And ये जो सारे के सारे drugs होते हैं, mainly we talked about two drugs. The very first one was Rytodrine and the second one was isoxsuprine. And हमने ये drugs को एक specialized नाम भी दिया था, and that name was tocolytic drugs. Now let us understand and learn more few drugs which are directly stimulating our adrenergic receptor. To start off, let us start with our dopamine. Now ये जो dopamine होता है, it can stimulate dopaminergic D1 receptor. It can stimulate our beta-1 adrenergic receptor, as well as it can stimulate our alpha-1 adrenergic receptor. Now wait, ये जो डोपामिन है ये सारे के सारे रिसेप्टर को स्टिम्युलेट तो कर सकता है, but this stimulation is dose dependent. Now what do I mean by dose dependent phenomenon? Let us see. Whenever we are giving dopamine in low dose, that is less than 2 microgram per kg body weight per minute, it stimulates our D1 receptor. The next question is, कहाँ पे D1 receptor होते हैं? So remember, ये जो D1 receptor होते हैं, they are present in almost all our blood vessel. जैसे हमारे पास blood vessel में we have alpha 1 as well as we have beta-2 adrenergic receptor. Similarly, हमारे blood vessels में we have D1 dopaminergic receptor. Now, whenever we are stimulating this D1 receptor, there will be vasodilation. And remember, ये जो D1 receptor होते हैं, इनकी मैक्सिमम कॉन्सेंट्रेशन रीनल ब्लड वेसल में होती है. So whenever this D1 receptor on our renal blood vessel is stimulated, there will be dilation of renal blood vessel. उससे क्या होगा? More blood can go to our kidney and our glomerular filtration rate will increase, and thus there will be increase in urine output. Now, what is the use of increasing this urine output? जब हम therapeutic use of dopamine discuss करेंगे, at that time I will tell you. Now, let's increase the dose. If we give dopamine in the range of 2 to 10 microgram per kg body weight per minute, our dopamine gets an add-on quality to stimulate our beta-1 adrenergic receptor. Now, in a moderate dosage, our dopamine gains an add-on quality of stimulating our beta-1 adrenergic receptor. But remember, जब हम डोज बढ़ाते हैं, जो पिछला रिसेप्टर है, in this particular case, in the low dose, our dopamine was capable of stimulating D1 receptor. So, in moderate dosage, beta-1 भी stimulate होगा and D1 भी stimulate होगा. Why D1 will get stimulated? Very simple, because for the stimulation of D1 receptor, we need low dose of dopamine. Remember that. Now, when we give this dopamine in high dose, that is greater than 10 microgram per kg body weight per minute, it gets an add-on quality to also stimulate our alpha-1 adrenergic receptor. Now, ये जो alpha-1 adrenergic receptor है, ये कहाँ पे present होते हैं? They are present in our blood vessels. And उसका काम क्या होगा? Vasoconstriction होगा and it will increase our blood pressure. Now, before moving on to the therapeutic use of dopamine, I would like to explain to you what do we mean by shock. Now, जब हम shock के बारे में discuss करते हैं, we mainly discuss about three main types of shock. The very first shock is known as hypovolumic shock. The second one is known as cardiogenic shock, and the third one is known as septic shock. Hypovolumic, hypo का मतलब होता है reduction, volume, यहाँ पे we are talking about blood volume. So whenever there is sudden reduction in our blood volume, that type of shock is known as hypovolumic shock. The second one, that is cardiogenic shock. In cardiogenic shock, हमारा जो blood volume है, that is normal, but our human heart is not able to produce enough cardiac output, and such kind of shock is known as cardiogenic shock. Now, कुछ shock ऐसे होते हैं which are triggered by bacterial infection. हमने माइक्रोबायोलॉजी में पढ़ा है कि ये जो बैक्टीरिया है, we can classify them as gram positive and gram negative bacteria. Now ये जो bacteria है, they release some kind of toxins, and such kind of shock is known as septic shock. Now shock में बहुत सारी चीजें abnormal जाती है, but you need to remember one thing. In shock, there is severe reduction in blood pressure. So our main aim in shock is to increase our blood pressure, and अगर cardiogenic shock है, our main aim is to increase the blood pressure and also to stimulate our human heart. And our dopamine can be used in case of cardiogenic as well as in cases of septic shock. Why? As it increases blood pressure. How it will increase the blood pressure? Very simple. Our dopamine can stimulate our beta-1 adrenergic receptor, and also it can stimulate our alpha-1 adrenergic receptor. And whenever these receptors are stimulated, there will be increase in blood pressure. Now, एक add-on advantage भी हमें मिलता है. What is that advantage? This dopamine can also stimulate D1 receptor, and as I told you कि D1 receptor की जो maximum concentration है, that is present in renal blood vessel. Now आपका question होगा कि renal blood vessel में अल्फा 1 भी था and D1 भी है. But remember, D1 receptors are more present in our renal blood vessel as compared to alpha 1 adrenergic receptor. So D1 की जो vasodilatory करने की power है, that overpowers our alpha 1 action, so there will be relatively more vasodilation as compared to vasoconstriction. Remember that. And very importantly, by our D1 action, it dilates our renal and mesenteric blood vessel and improves the blood flow to the vital organs. Now the second case जहाँ पे हम dopamine use कर सकते हैं, that is heart failure with renal impairment. Now the question is, what do we mean by heart failure? In simple words, just remember, our human heart is failing to meet our body's metabolic demand. And in cases of heart failure, our body restricts the blood flow to some of the organs. In that particular case, for example, if we consider renal blood vessel, in some cases of heart failure, we need to dilate our renal blood vessel, and our dopamine can do it very well. It can stimulate our human heart by beta-1 action, and also it can improve the blood flow to the kidney by its D1 action. Now एक condition और है जहाँ पे dopamine is the drug of choice, and that is shock along with oligourea. Now the question is, what do we mean by oligourea? Simply just remember, there is severe reduction in urine output. So in that particular case, dopamine is the drug of choice. Why? Because in shock, as I told you, blood pressure कम होता है. Our dopamine can increase the blood pressure, and also it can dilate our renal blood vessel. उससे क्या होगा? More blood can go to the kidney, and there will be more GFR, and thus there will be more urine output. So our dopamine is a drug of choice in cases of shock along with oligourea. Now let us meet our next drug. Our next drug is synthetic catecholamine, which structurally resembles dopamine, and the name of this drug is dobutamine. But remember, structurally तो dopamine को resemble करता है, but our dobutamine is not having any effect on D1 receptor. Its main action is on beta-1 adrenergic receptor. So we say that it is a selective beta-1 adrenergic receptor agonist. Now in which condition we need to stimulate our human heart? In cases of acute heart failure. Now a question आता है, when to use dopamine and when to use dobutamine. Remember, whenever we just want to stimulate our human heart, we can consider using dobutamine. Why? Because dobutamine is having its main action on beta-1 adrenergic receptor, and beta-1 adrenergic receptor का जो concentration है, that is more in our human heart, so it will stimulate the contractility of ventricles, and thus it will stimulate our human heart. Now अगर आपको हार्ट को भी स्टिम्युलेट करना है, and you also need to improve the blood going to the kidney, in that particular case you will use dopamine. Why? Because dopamine is having its D1 action, and D1 receptor is present in our renal blood vessel, so it will dilate and improve the blood flow to the kidney. So when in case we need to stimulate only our human heart, we can consider using dobutamine. But in cases of where we also need to improve the blood flow to the kidney as well as stimulate our human heart, we will consider using dopamine. Now let's move on to a very selective D1 receptor agonist. The name of this drug is Fenoldopam. Now ये Fenoldopam जो है, it is a selective D1 agonist. As I told you कि ये जो D1 receptors होते हैं, they are present in almost all our blood vessels. And जब हम इसे stimulate करते हैं, what will be its response? Vasodilation होगा, and because of vasodilation, there will be reduction in blood pressure. Now ये जो Fenoldopam है, we can use in case of hypertensive emergencies. Now the question is, what do we mean by hypertensive emergency? So whenever our systolic blood pressure is greater than or equal to 180 mm of mercury, and diastolic blood pressure is greater than or equal to 110 mm of mercury, this is considered as hypertensive emergency. And in this particular case, we need to rapidly bring down our blood pressure. In that particular case, we can use Fenoldopam. So Fenoldopam is administered as IV infusion in cases of hypertensive emergencies, but it is having some kind of side effects. For example, headache, flushing, reflex tachycardia can be seen. Now, let's move on to the next drug, that is phenylephrine and methoxamine. Now, ये जो drugs है, they are selective alpha-1 adrenergic receptor agonist. Whenever we stimulate our alpha-1 adrenergic receptor, there will be vasoconstriction, and thus it will increase our blood pressure. So these drugs can be used in case of hypotension, that is low blood pressure, in case of nasal decongestant, and also as a mydriatic. Now, why do we need to dilate our pupil? Now, जब हम आई चेकअप के लिए जाते हैं, डॉक्टर नीड टू डू proper fundoscopic examination. So in that particular case, for fundoscopic examination, doctor dilates our pupil so that doctor can check कि हमारे आँख में जो भी structures है, whether they are normal or abnormal, and mainly हम इसमें phenylephrine यूज करते हैं as a mydriatic for fundoscopic examination. Now let's move on to nasal decongestant. But the first question is, we need to understand what do we mean by nasal congestion. Nasal congestion का simple ये मतलब होता है नाक बंद होना. So those drugs which can open up our nose, those drugs can be considered as nasal decongestants. The examples are nafazolin, oxymetazoline, xylometazoline, and mainly these drugs can be used as topical agents. We can also use pseudoephedrine and phenylephrine. Mainly हम इसे ओरल फॉर्म्यूलेशन के फॉर्म में देते हैं. अब ये नेजल डिकंजेशन करता कैसे है? The answer is it stimulates our alpha-1 adrenergic receptor and causes vasoconstriction in the nasal mucous membrane, thus relieving ourselves from nasal congestion. It can be used in cases of allergic rhinitis, common cold, and sinusitis. Now, let's move on to the next drug. This drug is very funny. Why? ये जो ड्रग है, जब ये एड्रीनर्जिक रिसेप्टर को स्टिम्युलेट करता है, our sympathetic outflow is getting reduced. Now, जब हम एड्रीनर्जिक रिसेप्टर्स पढ़ रहे थे, in that हम लोग ने एक ऐसा रिसेप्टर देखा था which is acting like a brake. Can you remember that receptor? Yes, you are right. The name of that receptor is alpha-2 adrenergic receptor. So our some drugs can stimulate this alpha-2 adrenergic receptor, and whenever we are stimulating this alpha-2 adrenergic receptor, there is a reduction in sympathetic outflow. Now, ऐसे कौन से drugs है? We mainly have alpha methyl dopa and we have clonidine. अब यहाँ पे इन वन ऑफ द वीडियो लेक्चर हमने डिस्कस किया था द मैकेनिज्म ऑफ एक्शन ऑफ अल्फा मिथाइल डोपा. This alpha methyl dopa is getting converted into alpha methyl norepinephrine, and this alpha methyl norepinephrine is having potent action on our alpha 2 adrenergic receptor. Now ऐसे ड्रग्स हम कौन से कंडीशन में यूज करना चाहेंगे? The answer is in cases of hypertension. Alpha methyl dopa is considered as the safest drug in cases of hypertension in pregnancy. And also we have clonidine, which can also act on our alpha 2 adrenergic receptor, and it will reduce the sympathetic outflow. So that's it for today's video lecture. If you find value in my teaching, please consider subscribing to my YouTube channel. Please like the video and share it with your friends. In the next video lecture, we will go and we will see the indirectly acting sympathomimetic drugs, and we will also see mixed acting sympathomimetic drugs. So see ya until the next video. Take care. Bye bye. Have a good day.